So, how was your experience about the traveling, the procedure over here, the legal procedure also, the affidavit and everything, that is also done, right?
Yes, that will
Yes,
do.
and the pre-surgery evaluations.
Yeah.
So, how was your experience regarding that?
I found it all quite easy to understand.
Pretty much okay.
From start to finish, the phone call and the WhatsApp.
Right.
The link with yourself, watched your video that
Right.
some other surgery you done. So I was quite confident you were the man for the job.
No, thank you.
And since you do A-man as well, obviously you're quite fit and you're determined in what you do.
Thank you. That's very kind of you. How
I mean, the legal side, that did knock me for 6.
Okay.
But it was just strange having about the 3 cycles.
Yes, because there are 2 independent psychiatrist evaluations plus
Yeah.
a psychological assessment and then the legal affidavit. All
Yeah,
that
I know.
has
There's a lot to do, isn't there?
It is kind of tedious, yes.
Yeah, but I know it's the law in India, so yeah.
It has to be done.
Yeah.
But then you are legally covered from all aspects.
Yes.
Yeah, so you want to go for any document change or whatever, all the
Change your
you have
passports,
all
all-
the documents with you, right?
Yeah.
With you.
And when they get them tomorrow morning,
Which ones do you want?
the gender change.
The certificate, yes.
Yeah.
You want me to mail that to you? That
Yeah, that'd be great. Yeah,
And the affidavit also is there, so all
All
that
right.
is pretty
That's all right then, yeah.
That should be fine.
that's wonderful.
Other than that, then you had your pre-surgery evaluations, the fitness thing in the hospital,
Yeah,
and then the actual surgery and the stay in hospital. So
Yeah.
how was that experience for you?
the experience itself was all absolutely spot on, and the care is wonderful.
Oh, thank you. And the main part is, any suggestions you would like to offer to make either the pre-surgery part, the evaluations,
Yeah.
or the pre-surgery investigations and the post-surgery experience, anything you would suggest to make it more comfortable or maybe faster? Anything you
Absolutely
have in
not.
mind?
It's just perfect the way it is.
That is perfect. Okay. If there was anything good,
The girls,
yes.
they're brilliant.
Oh, I'll be sure to pass on the compliments. That should be nice. So now almost everything is done.
Yeah.
This part is something you should go through.
Okay. Yeah.
As far as your original documents are there, the evaluation and everything, you'll be getting all of that in a file.
Right. Okay. Yeah.
The affidavit as well as the assessment documents.
Yeah.
And we'll be giving you a letter ready for the travel, that is also ready.
Right,
And
okay.
also on the hospital letterhead stating that you have undergone this particular procedure.
Yeah. I
And,
get the wheelchair.
yeah. So medical assistance definitely yes.
Yeah.
And also a certificate stating that yes, the physical part of the procedure is done.
Yeah.
So
Yeah.
whatever else you want to go for, hormonal treatment or anything, you're free to go forward with that. From our side, it's all clear.
Yeah. But you also recommended not to do any more surgeries for 3 months, aren't you?
Yes, that I'm recommending considering your heart condition.
Yeah.
Because we'll be explaining that also to you that there have to be some medicines you are going to be taking for the next 2 to 3 months.
Well, I've had them since we were born, the heart murmur, so it gets me how it's affected us.
The murmur is fine.
Right.
Just having the murmur is not an issue.
Right.
But when you're going for intra-abdominal surgery,
Yeah.
like we did for the laparoscopic part, right?
Yeah.
So that's when we put in some gas inside the abdomen, increase the pressure inside the abdomen.
Yeah.
That will cause some extra load on your heart.
Ah, right.
Right.
So what about facial feminization?
That should be fine because you're not going inside, you're not putting
Oh,
pressure over there.
okay,
So that
yeah.
would be good. That should not be an issue for
Right,
you.
okay.
Anything inside your stomach cavity, which is going to cause, laparoscopic procedures,
Yeah.
those for the first 3 months, elective ones, not to be.
Because these are all right. When I got these done, there was no.
Again, you're not going inside.
Ah, right,
The
yeah.
thing is entering inside the abdominal cavity. That is something for 3 months we should be wary of.
Right, okay.
Superficial.
Not that I'm doing anything for I was talking about February, March time for
Perfectly
the
fine.
facial.
Anything surface, also surface, facial, again staying outside,
Yeah,
you're good.
right.
But
Do
again-
you do that as well?
We do that as well.
Right.
But I would still say if it's an elective thing, let's
Yeah.
not do it for the first 3 months.
Yes, well, I've got no
After-
intentions.
yeah. After-
But that's what's been strange.
Yeah.
I've watched loads of videos about the procedure, and everyone goes through absolute bad pain. With you, I've got a bit of discomfort, but I've not had any pain. I don't know
I
why.
think that's more on you, your tolerance and your willpower is way too good.
it's on you.
Let's track it all.
Yeah, right, 50-50.
50-50. So that is it. We're done for this.
Okay.
And we'll be meeting again today evening.
All right, okay.
Yeah, so any doubts we have, that's the time to clear them.
Right, okay. I've got no doubts.
If you have them.
Yeah. No, I'm very happy. Thank you.
Thank you so much.
Thank you.